Don't forget to wipe your surfaces, you already do it anyways. You can clean your hands. And you have all the products in your cart, so you're gonna put it on top and start opening your items. Now, that depends actually, let me just pause. You can choose to start taking off. If you have 2 people and the line is gonna be secure, you could choose to have somebody else just watch your sterile field or watch the patient, so it just depends on what you feel comfortable doing. Okay,
Lisa, can you please put on a party hat?
yes.
Your hair's hanging out.
It's okay.
No, it's not. It all needs to be up.
Okay.
We're doing the good stuff. So I know that this patient has a PIC, and I know it's not sutured because I looked it up. So I know that I need a securement device, like a teddy bear stat lock, because there's also not a secure cap on there. So I'm pulling out my securement device, my teddy bear stat lock, my dressing change kit, and my sterile gloves. And then I will take out my adhesive remover spray, which is only used on the top of the dressing. And then I will take out some wipes,
Non-sterile wipes, by the way.
adhesive remover wipes. And I'll take out a detachable or 2 just to have handy. And this is a 3 French stat locks, PIC. So the bio patch that's in here is an appropriate size. Okay. If this was a Hickman, like in the chest or a Broviac, I would need a larger bio patch, which is
There's
not.
3 sizes. 1.5, a 4 millimeter, and a 7. The 7 is mainly for hemodialysis lines. The 4 millimeter is for anything larger than, you can use it on a 4, or you can use a 1.5 and a 4, but manufacturer recommends a 4 millimeter on a 4 French line. But we offer you a 1.5 inch in the kit, and we put on 1.5 on the, we just kind of like it stretches and goes around, so.
And
On the
you
4
can
French, which
see
we
the
see most
difference
often.
in levels. The size. All right.
The idea is to get the coverage. So for me, how I kind of structure it, I have my sterile stuff and then I have I'm removing it. So it's like kind of 2 procedures. Removing your dressing and then putting on. So when I remove, I have the 3 items as well. The tactile and the 2 unsterile adhesive removal devices. Okay? Always ask your patient, what do they prefer? How do they like to do it? You know, the whole pediatric sensitivity that we have to make sure we do.
So if my patient was, this is a 3 French, so this could be a small child. So I would maybe swaddle the baby, ask the parents how they respond. Do they want sweeties? Do they want, whatever. Or this could be a teenager who has a 3 French because they got osteo and, we put in 3 Frenches across the board, but it is a very tiny line. But again, we will put a 3 French single in for kids to go home, could be a teenager, and very cooperative, so. Would you like this baby to be screaming or cooperative?
But you guys do have to go, it's the same idea. There's not a lot of differences. You just want to be able, your biggest concern is staying sterile and not allowing for line migration. We don't want the line to dislodge, pushed in or out. Always try to keep the line. That's really a goal. So the person who's sterile, that's a big part. So you guys do this already in terms of sterile techniques.
And then if it is a small baby and there is any line migration, we want to take assessment of that. If it's a significant migration, like your hand slipped off and the baby kicked and you now have migrated this line, it could mean the difference between central and not central in an infant. So then, you would obviously call the provider. You would say, hey, I migrated this line by 2 cms or whatever it was. They will order an x-ray, and if it's a lower extremity, it needs to be KUB. If it's an upper extremity, it can be chest. Are you the patient?
Sure. I'm going to hold it this
Why does that work?
Hi.
I'm going to remove your dressing. Okay. Do you have anything specific that you want me to do?
I just like that you tell me everything that I like, that you're doing, and that you go slow.
Okay.
Also, guys, I have this rule. This isn't policy, but I take my spray and I'm allowed that you can spray on top as much as you want. Then I like let it sit for a little while. That's just a little. I'm sure you know how to use that thing, but just so you know, once you get to that like window part, so like you can lift the edges with that wipe. Okay, still okay. Once you get beyond the edges, only detach all. If you're no spraying, no wipes, none of that stuff. It's just not sterile. So.
Can you please sit back down? Okay. And then this is a blanket or something to
really
support
important.
the arm.
Yes, really important. You want to have the arm in a really supportive way. So when they're down like this, or you just make sure that you have something to support them with.
Okay, and everybody in the room has a bouffant. So I'm gonna spray right now. It's gonna feel cold and wet.
I'm just gonna turn it this way for
So it drips on the table. You know, and I usually get under one edge.
What's wrong with this pick line?
There's no Curos cap.
No Cura.
Not the.
It's not clam, so I would check its patency. This is when you do your assessment. Oh, hey, so what time, like, when was the last time you got your meds? Like, you talk to them and they can tell you everything. You don't even need to look at the chart. They know everything about their lines. Oh, that's funny. You put the line in.
Oh, I meant to tie it. Okay, so now I got this all loose. This is as much spray as I can use. I'm gonna, I love Detachol because I can actually get under there and I use it as my helper. I'm not a big fan of these wipes that much. The only time I will take them is if the patient doesn't like the cold spray. I spray it on the wipe and then I just let it rest on there. So I want, basically, I'm gonna start, because this is already lifted, you know, so I'm gonna go under, work on these corners.
So one thing with Detachol, it's very tempting to go from out to in, like you've got more oil left in there. What I do with mine is I'm mindful that this is the parameter I'm gonna stay in, so I make like a little bit of like a frame. You don't wanna go back in because you're introducing more bacteria. So you may have to use a few after you get the border off. But you can't start like going in and be like, I got more to do here. That's just not gonna be sterile. So when removing the rest of this, would you go up or down? Which way would be safer, you think? I should ask proximal distal, but I really don't know, so. It would be proximal, what?
So if you go down and pull it, migrate it versus going.
Right, yeah, so you wanna go up so that in case, yeah, so that you don't have that migration out, right?
I always take my glove and kind of have my finger there, and then I start, because this is no longer on the patient's skin. This is just tape on tape, basically. So I'm not really pulling much on their skin. And this is where it's starting, you know, skin. So, and then you see my finger's still there. Okay.
This is the safest way to take it off.
Okay. So now I need to get sterile, right?